A person struggling with rejection sensitive dysphoria, or RSD, experiences intense sensitivity to any perceived or suggested criticism. It is not a diagnosable condition and is rather a symptom commonly seen in those with ADHD. Hi, my name is Kristen Souza, a licensed mental health counselor specializing in ADHD. And let's talk about the connection between rejection sensitive dysphoria and ADHD. So first, what is RSD, or rejection sensitive dysphoria? Rejection sensitive dysphoria is an intense emotional reaction to actual or perceived rejection, disapproval, or criticism. It can look like anger, resentment, sadness, hurt, a lack of understanding around why you feel the way you do. This can impact someone in many ways, including social anxiety, difficulty attaching to others, lack of trust in people's intentions, low self-esteem, and depression. There's no formal diagnosis for RSD, as it's more of a symptom diagnosis than a diagnosis itself. RSD can be often associated with attention deficit hyperactivity disorder, generalized anxiety, major depression, borderline personality disorder, autism, and bipolar disorder. RSD symptoms can present as mild, moderate, or severe depending on the situation and context of rejection. Some RSD symptoms can resemble mood disorders, anxiety disorders, and even personality disorders. Common symptoms of RSD include fear of failure, low self-esteem, a chronic fear of rejection, catastrophizing small rejections, high expectations of oneself, avoidance of social situations, perfectionism, seeking validation, aggression in social settings, feelings of hopelessness or helplessness, increased anxiety in new social settings, malicious and invective responses to rejection. So what is the ADHD-RSD connection? RSD can be caused by a few different things, including early childhood abandonment or neglect, repeated experiences of rejection, and untreated mental health issues. Individuals diagnosed with ADHD are more likely to be deemed as lazy, unproductive, a lost cause, difficult to manage, and failures in childhood. These rejections can really add up over time. In addition, when ADHD begins to impact how a person functions in a relationship, romantic, or friendship, it can lead to increase in rejection. Furthermore, RSD is viewed as a symptom of ADHD, not the other way around. This is because ADHD is a neurological disorder of the brain that can cause a disruption in one's mood. RSD is a mood disruption directly resulting from how someone views themselves in this world. Our perception of the world can impact our reaction to rejection, criticism, and disapproval. Unfortunately, those who have ADHD, this increased sensitivity can lead to further complications, such as issues with maintaining employment, establishing stable housing, and substance use, among others. People with RSD and ADHD have a heightened risk of the following: homelessness, having multiple failed roommate or landlord situations results in difficulty finding housing. This can result from forgetting to pay rent, frequent disputes to criticism, or anxiety that has developed out of fear of criticism and rejection. Unemployment, having a big emotional response to constructive feedback or criticism in the workplace can result in job loss. Let's say your boss gives you helpful feedback to a project you're working on. Instead, you take that feedback as you're terrible at your job, you did a horrible job, etc., when really your boss was giving you constructive criticism to make the project better. So you really take that, you're really sensitive to that criticism that your boss gave you, even though it wasn't that you did poorly on the project, it's just how to elevate your current situation and your current project. The next one being social withdrawal, the perception that you're unlikable or that others will inevitably reject you can result in the lack of social interactions and fears about socializing. So a lot of times people who experience RSD often have social anxiety as well. The fear of being rejected is because of the fear of being rejected. Emotional unavailability, so fears of rejection by others can result in not wanting to make deep connections with people. Suicidal ideation, feeling hopeless or helpless that the situation can result in feeling. The next one is aggression. In an attempt to get others to understand and not reject you, you may become more aggressive in tone or physicality, especially at the end of a relationship due to ADHD symptoms and RSD reactions. Lastly, substance use disorder. Finding ways to cope with the strong emotions of RSD can be difficult. Oftentimes, especially with ADHD, people self-medicate using substances. So how do you cope with RSD and ADHD? When trying to work through RSD and ADHD symptoms, it is important to develop healthy coping skills rather than unhealthy ones. In addition to seeking treatment, some of the most helpful coping methods include journaling, mindfulness, exercise, and creativity. The misconception with ADHD is that all symptoms are negative, and I always like to tell people and clients that ADHD is kind of like your superpower. You are creative and you do things in your own way, and that's okay. So let's go over some self-coping skills you can try if you experience RSD and ADHD. Try self-soothing. Self-soothing is a way to improve our emotional state without the assistance of others. This can be helpful as we often isolate and withdraw from others when we are struggling. Self-soothing can include progressive muscle relaxation, meditation, counting down from 5, mindfulness, and the square breathing technique. Practice emotional self-care. This is a big one. Emotional self-care can include talking to a friend, setting boundaries with people that make you feel bad, paying attention to what it is that you need, and following through. Journaling for your mental health is a way to connect with emotions and process them. Journaling can really help when you're feeling stuck. Get creative. Creativity helps us process our emotions differently than talking. This can include art, music, dance, and cooking. Exercise. This does not have to be intensive exercise. However, finding 15 to 30 minutes a day to move your body in a way that feels good to you to increase serotonin and dopamine levels in your brain can be so helpful, especially with someone that has ADHD and dealing with RSD. Final thoughts. RSD and ADHD can present challenges that impact our home, work, and personal lives. While it may feel you're overreacting, dramatic, or unlovable, that is not the case. Finding help, leaning on your resources, and learning healthy coping skills can make the difference in your experience. If you or a loved one are struggling with ADHD, you don't have to do it alone. Talking to a therapist that specializes in ADHD can help you understand your symptoms better. We've linked some valuable resources in the description and comments to help you find a therapist, psychiatrist, and other useful resources. Check them out.